There is turmoil at the CDC, controversy at the FDA, and reporters digging to find out why keep getting directed to the White House. That turmoil comes as the president and top allies paint a coronavirus picture that doesn't quite match the coronavirus reality. Let's look at the latest trends, and let's start with our 50-state trend map. 18 states right now, that's the red and the orange. You see a lot of them out here in Middle America reporting more cases today than a week ago. 18 states trending in the wrong direction. You see 23 states, that's the beige from coast to coast, holding steady. Only 9 states at the moment reporting fewer cases now than a week ago. Importantly, they do include Florida, Texas, Arizona, and California. Those were the states that were the big drivers of the summer surge. They're in better shape right now as compared to earlier in the summer. If you look at the case curve, this is instructive. This is where we are right now, averaging about 42,000 cases a day. This is the peak of the summer surge, 67,000 cases a day. Just before that peak, one day before that peak, is when the president finally showed up in the White House briefing room to hold up a mask and say masks are good. That was after this giant summer surge. You go back to June, we were down to about 20,000 cases a day. Then that. We have Texas reopening here. Just to remind people, the reopening started with Texas, Florida soon after. Other states started to reopen. We've gone through this for 7 months. You count a couple weeks, up we go. So here's where we are right now. And this is, if you look at it from this perspective, still 42,000 cases a day. So you need to test to get eyes on the virus. Well, we're averaging about 700,000 tests nationally. 16 states trending up, meaning more tests now than a week ago. 15 states trending down, fewer tests now than a week ago. And if you look at it this way, this is what gets interesting. The positivity rate, still 12% in Florida, 15% in Mississippi, 18% in Iowa, 14% in Missouri, 15% in North Dakota. A lot of these states still have a high positivity rate. You want that rate down, 5% or lower as you watch this play out. Just want to bring up a couple quick other points we want to look at here. Where are we watching? Cases rising, right? Down in Florida a bit, down in Texas a bit, down in California, but look at Illinois, look at Kansas, look at Kentucky. Again, in Middle America now is where we're seeing the cases come back up. And because of that, because of the rise in cases in the middle of the country, the IHME now increasing its projected death toll. It projects 317,000 Americans will die by December 1st. 1,400 days. Deaths a day. Joining me now is Dr. Margaret Hamburg. She served as FDA commissioner under President Obama, also a former New York City health commissioner. Dr. Hamburg, I'm grateful for your time. One of the challenges has been, if you look, the American Medical Association, the Infectious Disease Society of America, the American Academy of Pediatrics, the National Association of County and City Health Officials, the Association of American Medical Colleges, all objecting to these new CDC testing guidelines. The guidelines essentially saying fewer people need to get a test. If you're asymptomatic, you don't have to worry as much as we thought you did months or so ago. If all of these organizations that do public health are saying bad idea, why is this happening?
It is hard to understand some of the recent decisions. CDC is an extraordinary agency, considered by many to be the best public health agency in the world. It is historically trusted and trustworthy, but we're seeing decisions come out in ways that frankly undermine confidence of public health officials and medical care experts, and the confidence of the public. This is a time, on the testing question you just mentioned, when we need more testing. Truth is, we don't have enough tests, so we have to have a testing strategy, a plan as well, to use tests wisely and to make more tests available. But right now, we need to be testing to break the transmission of this virus, to get this pandemic under control, and to achieve the goal we all want of being able to get out from under COVID-19.
Well, especially, you mentioned the testing dilemma. When you see 18% in South Dakota, 18% in Iowa, 24% in South Carolina, still in the teens in Florida, Texas, states that drove the summer surge, everyone would say you need more testing to keep good eyes on the virus. When you were here in Washington, look, there's also a controversy at the FDA. The administrator there, the commissioner, had to apologize because when they rolled out the emergency authorization for convalescent plasma, he said wildly optimistic things about its effectiveness. They then fired a woman who the White House had put in there as the top spokeswoman. You worked here in Washington. She's still at the agency, but they pushed her out of that job. You worked here in Washington, the Obama administration. There's always politics in Washington, and there's especially politics in a re-election year. Is this normal, what you're seeing, or is it over the top?
This is not normal. Certainly, yes, there's always politics in Washington, and there's always a set of political pressures that come to bear on important agencies like the FDA or the CDC. FDA, in particular, is subject to many different competing priorities and pressures, and you're working, if you're at the leadership of FDA, at that critical perilous interface of science and politics. But the job of the FDA is unique and essential, and the public has to be able to rely that it is making decisions based on the best available science, on real evidence. And if that is not the case, then we are in serious trouble. And we are seeing a level of political intrusion that is really quite remarkable, and it's coming at a really worrisome time, because over the next weeks and months we're going to see data emerging from clinical trials about COVID-19 vaccines. We need to rely on the scientific integrity and independent scientific judgment of FDA. We need to know what the data is that they're looking at, how they're making decisions, and we need to know that FDA is also working with external experts and subjecting the data and their analysis to broader review as well. So these processes can go forward, and I am guardedly optimistic that they will, but we have to be sure. Otherwise, we'll undermine trust and confidence in FDA, trust and confidence in the products that they're evaluating. And when we need a vaccine more than ever to help enable us to move forward and get back to work, get our students in school, get our lives in order, and rev up our economy, we need a vaccine that's proven to be safe and effective. We also need a vaccine that people trust and are willing to take, because even a good vaccine will not make a difference if people don't trust it and won't take it.
That trust point is absolutely critical. Dr. Margaret Hamburg, grateful for your expertise and insights this Sunday.